The VERONA trial that was presented at ASCO, data was not yet presented, but they announced the trial. This is a phase 3 study that is really, I think, critical to the field. There's a few MDS trials right now that have generated a lot of enthusiasm. We have been waiting for a very long time for our high-risk MDS patients to have more than just hypomethylating agents to help to curb or prevent AML progression and to help to increase survival and quality of life. So the VERONA trial is the AbbVie-run phase 3 international randomized blinded trial where patients get azacitidine, which is either intravenous or subcutaneous formulation. It is not oral. And they either get Venetoclax at 400 milligrams daily for days 1 through 14 or a placebo. So patients will still get the standard of care azacitidine. The patients that are eligible include those that are eligible for transplant or not at the time of enrollment. We recognize that this regimen was very active in reducing or cytoreducing disease burden, and some patients in the phase 1 trial that were not initially considered to be transplant candidates became transplant candidates because of how good they felt and how great of a response they had on the trial. So for the phase 3, they allowed patients that would be considered a transplant candidate down the road, which again, transplant is still the only curative modality that we know of that's available for patients. And I thought that was a really forward-thinking eligibility criteria. Patients had to have an IPSS-R score greater than 3, meaning that they had to have at least intermediate risk disease and warrant therapy. This trial is being conducted internationally. There's some opportunity for patients to receive some local care, but receive the treatment at the clinical trial sites. So there's some built-in flexibility for an older patient population, which I think is really critical during the pandemic for an elderly population, which is fairly unique compared to some of the other MDS studies that are being presented. This VERONA trial has the primary endpoint, which is super critical and will lead to our third question of looking at overall survival and CR rate. That's really important because the gold standard for success in MDS has been overall survival. It's the one that's been held up this whole time. And at this point, they are splitting the primary endpoint. Some exclusions for the trial that are worthwhile to note, and this is very similar to patients that were being considered for the phase 1b trial. Any patient that had received prior hypomethylating agent would not be eligible. That makes sense, especially because you might get hypomethylating agent alone. And those with any overlap syndrome with MDS myeloproliferative neoplasms or MDS MPNs, they were also not allowed. Patients with known therapy-related MDS were also not allowed on the clinical trial.